Michelle.
Thank you. Welcome to Yuma. Welcome to Yuma. We're happy to have you here. Your whole group has been amazing.
Thank you.
Yes. Good morning, Joanne Cox. I'm the
Enjoying to
Chief
see you.
Experience Officer here. Welcome.
Good to meet you. Thank you so much.
Good to see you.
Thank you so much. Oh, wow.
Pleasure to have you.
Thank you so much. Yes, sir. Thank you as well. Appreciate y'all taking time to be here. Morning.
Can everybody be seated, please?
Thanks, sir.
Appreciate everybody being here, and in the interest of time, we'll dispense with anything else other than to welcome Senator Scott here to Yuma. We've been at this table several times as a community, and Senator, I think one of the things that's most important about our community is that we come together to resolve problems. So some of the challenges that we've had don't necessarily get broadcast beyond Yuma because everybody steps up and resolves the challenges together. From our food bank to our women and children, from our agriculture, especially to our healthcare, who has borne the brunt of some of the challenges, and then our first responders, state and local and federal. So thank you very much for being here to find out what we can do. I know that the sheriff will share those 15 points with you, Sheriff, right?
Not yet.
I love to put the sheriff on the spot, and
Shouldn't have said a word.
Yeah, sorry. Senator Scott, we'll turn the time over to you.
Well, thank you very much. And thank you all for taking the time to be here and have a serious conversation about one of the most important issues our nation faces that we still have unresolved, frankly. I was at the border in 2019, and the thing that's changed the most is Joe Biden is coming into office, has allowed for more than 6 million folks to cross our border illegally. And perhaps equally as important is the 70,000 Americans who have lost their lives to fentanyl. I will say that earlier this year, a very good friend of mine, Alan Shaw, who is a business school dean at the College of Charleston for a number of years when I was on the board of the business school, lost his son this year, 27-year-old namesake Alan Shaw, because of fentanyl. Devastation. So the importance of building a wall, finishing the wall, using the available technology to surveil our border, to stop the flow of fentanyl across our border, really important. Crushing the Mexican drug cartels, absolutely essential. As President of the United States, I would sign the legislation I created that would freeze the assets of the Mexican cartels. We have the power to do that, and frankly, it's good news that my bill has been passed through the Senate, and hopefully will become law before this year is over. And then focusing on trying to find a way to bring more Border Patrol agents to our border by eliminating the 87,000 IRS agents that's a part of the Inflation Reduction Act. I would be helpful to using those resources to provide more security on our border. I had good conversations this morning about the impact that Yuma has from a farming perspective and providing the lettuce that we see around the country, particularly, I think it was from Thanksgiving to Christmas. Is that 93%? Is that right? Easter. Yeah, I knew that was too short of a period of time. 4 weeks. Yes, almost 6 months for the 93% of the lettuce we see comes from Yuma. And as some of my team was talking about, that Subway uses a lot of the agriculture right here to produce the lettuce that they use as well. So really important issues, from saving lives to protecting our border and our country. And we'd love to honestly have a dialogue so I can absorb more information than just a monologue of me talking about what I know that you all already know as well. But to the healthcare workers, thank you for your dedication to your community. My mother spent 50 years at St. Francis Roper Hospital, and she just retired about 2 2 months ago after 50 years. Thank you. Thank you very much. But being aware of the importance of the work that you do in healthcare is undeniable. I've served on a hospital foundation board trying to raise money for indigent care, as well as an operating board for a short period of time. The foundation board was more fun. The hospital board more frustrating. So but both were good experiences for me. And so thank you all, and to the law enforcement in this room. Thank you for what you do to protect our citizens around the country and specifically on the border. I'll simply finish by saying this, that because of fentanyl, every county is a border county. The devastation is felt throughout the entire country. No matter what state you're in, you feel as if a part of your community is being impacted because of the border. So Jonathan, thank you for being the host.
You're very welcome.
Appreciate it.
And to that point specifically, our rate here in Yuma, with the data the hospital provided to me, we're 16 to 17 times greater impacted by the fentanyl poisonings here. We have with us today Araceli, accompanied by my wife, whose son passed away with poisoning of fentanyl. She left my home and then went home with her 2 smaller children and found him in the throes of fentanyl poisoning, and he passed away 2 days later. So Araceli, and then Rosie's here to translate for her, and we are incredibly impacted by that loss. Muchísimas gracias por estar aquí con nosotros para compartir eso. Y si hay algo que quisiera comentar sobre eso, se lo puede compartir.
Hola, buenos días.
Thank you.
Mi hijo murió hace 4 años de fentanil. En verdad yo no sabía qué era eso. No sé si
She had no
apenas,
idea what fentanyl was.
no sé si apenas iba comenzando o cuánto tiempo tenía fentanil aquí en Yuma. Mi hijo tuvo una sobredosis, llegué del trabajo
It was an overdose.
y estaban los bomberos ahí en mi casa.
And the first responders were there with him in my home.
Desgraciadamente mi hijo más chico de 16 años llegó primero que yo a mi casa
Her 16-year-old found him on the floor.
y él lo encontró en su cuarto con sobredosis. No podían hacer nada, no pudieron hacer nada en mi casa, no pudo despertar.
They never woke him up.
Lo trajeron aquí al hospital.
They
le dio
took
un
care of him
paro
here in this
cardíaco,
hospital.
Le dio un paro cardíaco en la ambulancia.
He had a heart attack in the ambulance on his way over here.
Cuando llegó aquí al hospital estaban tratando de que reaccionara, no podían, no despertó, pero estuvo en coma.
And he was in a coma
Estuvo en
for
coma
a
por
couple of
3
days.
días.
3 days.
No pudo despertar nunca.
And he never woke up.
Y no entendí y no entiendo cómo una simple pastilla puede hacer eso.
She doesn't understand how a small pill could have such a tremendous impact.
Y no sé si los jóvenes yo sé que los jóvenes todavía no entienden qué tan peligrosa es esa pastilla.
She wants other kids to know, and she wonders
Porque-
if other children know and understand
Porque
how
no le tienen
dangerous it
miedo.
is.
No tienen miedo, no le tienen miedo de tomarla.
And they're not fearful of anything, specifically something so small.
Pienso que si hubiera más aprendizajes también para ellos como para nosotros los padres,
She'd like to see more
qué es el daño que hacen,
education about the dangers.
tuvieran un poco más de conciencia.
Then they would have a more of an understanding of how dangerous it is.
Porque no es fácil. Uno entiende cuando alguien está enfermo o tiene un accidente, ok, se murió porque está enfermo, pero que se muera alguien por una sobredosis.
Yeah. She just doesn't
No
understand
entendemos.
his passing over an overdose of fentanyl.
I'm sorry.
Yeah. Lo siento muchísimo.
Condolences. Condolences.
Se lo siente bien. Y May, is there anything that you would like to say regarding the education? Because we spoke about that earlier today.
Yeah. Such an important part of the equation is our ability to help our kids understand the one dose is all it takes. You can lose your life.
Eso es lo que él quisiera comunicar, de que con un sobredosis se puede pasar y aún fallecer.
The community campaigns are so effective when we can get the information to the most likely and most vulnerable folks who don't understand.
Y la educación dentro de la comunidad es una de las cosas sumamente importantes para dar a conocer. Entonces él se va a enfocar en eso.
Porque no lo hay casi, Jonathan. Casi no hay mucha educación sobre eso.
And she's still not seeing enough, and she'd like to see more from a community aspect.
Absolutely, absolutely. She's right. She's not seeing enough because the coordinated efforts that will be necessary for us from not just the government, but in the private sector as well. It's a all hands on deck in order for us to provide the type of illuminations necessary for the issue.
Sobre todos los sectores, se sabe que dentro de las comunidades, en cuanto a lo estatal y lo federal, todos tienen que colaborar para asegurar que damos a conocer la educación en cuanto a los peligros sobre el fentanil. Muchísimas gracias. I think probably the next most important thing, and we spoke a little bit about this morning, not the most important thing, I don't want to categorize that or disminuir, how do you say that? Diminish in any way. We're here in the hospital today, but one of the most important aspects of our community is our agriculture. It's one of our pillars aside from the military. These families have been here for a very long time. We have representatives from Yuma Fresh Vegetables as well as Western Growers, which is the Western United States. And you had the opportunity to visit with Corey this morning. We'll turn some time over to Robbie.
Well, thank you. And Senator, thank you very much for coming here.
Sure.
And what I've watched you speak on television several times. Obviously, first time I've had a chance to meet you face to face.
Yes, sir.
What I love about you is your love and passion for this country.
Thank you.
That's what really sets you apart from a lot of the others that are out there vying for this position. But like Jonathan said, my family's been here. I have a couple of nephews here, Hank and his brother Chris also, and we farm here. My family's been here permanently since 1912. They came from all over the U.S. and some of them from Mexico. And our operation employs just over 500 people full-time. We operate here in Yuma. We operate in Southern California. Pretty much all west of the Rockies have operations. And the Yuma area is home. It's critical, not just to our operation, it's critical to, as you have seen, to the food supply in the United States.
Yes.
And, we grew up on this border. I grew up swimming in the Colorado River, fishing in it, and all of the Mexican families on the other side did the same thing. We'd see each other, and at the end of the day, they'd go home and we'd go home. And of course, we had a few people that wanted to try to come across the border then, but it was nothing like we had today. In fact, most of them, the Border Patrol knew because they picked them up a week or so before and then took them home, and then they came back and they knew them by first name. Mm-hmm. But anyway, it just seems that, in fact, Jonathan mentioned that I'm on Western Growers Board. I've been on the Western Growers Association Board of Directors. First one on it in 1990, so I've been there for quite a while.
Yes.
And it's interesting how every meeting we go to, it seems like there's more battles that we have to deal with, whether it's on a federal level or on a state level. Thank goodness we're based in Arizona. We operate in California, and I'd rather not invest one more penny in California because it's such a hostile area. But we have to do more and more to lessen, to at least stop the spread of these horrible regulatory pressures that get dumped on us.
Yes.
We can't compete with the rest of the world, and that it gets more and more difficult all the time. The thing is, though, it seems like we're having to compete with the federal government all the time. And Hank will tell you about water here in a little bit. That's one of the biggest issues that we have to deal with around here. But this area, Yuma County, is in the top, less than 0.1% top ag-producing counties in the nation. And that, and it's critical, as I said, critical to our food supply. If you eat salads in the wintertime, it comes from here.
Yes.
Anyway,
Protecting the border is...
protecting the border is critical.
Absolutely.
And we want immigration. We want legal immigration. I've had discussions with family members of mine that have a little bit of a tendency to speak from the other side of the fence.
Yes.
And I, they seem to be okay with an open border. And I've asked them if they said, well, they say we need better immigration laws. And I said, have you ever been to D.C. and lobbied for immigration reform? Well, no. So when you go and have marched 100 miles through the halls of Congress like I have, then maybe you can speak about it with some intelligence.
Yeah.
But we have to get better immigration laws. We have to get a secure border, and we need bigger gates
Yep.
so we can allow people to come in more expeditiously on a legal basis and not use an app to come in as an illegal.
Yeah, if I was president of the United States, we would delete the app.
Yep.
Number one, that President Biden has ushered into smartphones. I think it's there's so many perverse incentives to break our laws to come to our country that watching our border be insecure, unsafe, and wide open is a problem that is colossal. And frankly, meeting with the sheriff this morning and talking about the fact that, like you said, in the last 12 months or so, 140 different countries are represented coming across the border as well. So it's sometimes we think about this as an issue with Mexico, when the fact of the matter is 140 countries. That's devastation.
One last comment about how we compete. I pay people, we employ a lot of people that are domestic workers.
Yes.
We also employ a lot of H-2A workers. And the average wage is approximately $20 an hour. We're competing with producers that pay $10, $12, $13 a day. Makes
Across the board.
competition
Yeah.
tough.
Yeah, no doubt.
So let's go to the food bank. Shara.
Well, it's a pleasure to have you here for sure. I've
Thank you,
listened
ma'am.
to you speak, and I like your passion.
Thank you.
Just like Robbie Barkley had said, you have to have passion for what you're doing, and you do demonstrate that. And we really appreciate you being here. That's part of your dedication.
Yes, ma'am. Thank you.
The food bank has been in crisis really since 2019. That's really when the first wave started. Our immigration laws are so broken that we're seeing it just in catastrophic measures right now. We're also seeing a lot of these people that are here, that have crossed over illegally, that are now given documentation so that they are eligible to come to the food bank. So typically before 2019, we were serving about 250,000 individuals annually through the food bank. That now is up to 340,000 individuals in all of Yuma County coming to the food bank at different times.
More than 25%.
We can't sustain that. That's the bigger issue, is that we're going to run into a problem. People donate here privately. That's the biggest part of what we are able to get is because those are private donations. A lot of it comes through our produce growers. From November through April, we receive a lot of overflow produce. It's getting to the point where we can't handle the load. So that's my ask of you is get the immigration issue and secure the border.
Absolutely. I mean, I think finishing the wall is an absolute necessity. The technology I talked about earlier is really important. Having an additional 1,000 immigration judges so that we can expedite the transfer back to their home countries are essential as well. So there are things that we can do literally day one that will help reduce the flow of illegal immigration, illegal immigrants, to not include the whole conversation on the national security aspect. I don't know why we have not heard more conversations about the fact that we found over 200 people on our national security watch list crossing our southern border. That means we found 200. Likely, exactly, crossing the border. So when you have 140 countries represented on the border, as high as 160 countries represented coming through the border, the number of folks that are coming from countries that have an adversarial relationship with us is spiking. And it's because there's a sign somewhere out there that says the American southern border is open.
Wide open.
And it's one of the more frustrating things that so many Americans are having to deal with and grapple with on a daily basis now.
There's another side to this too with the immigration. Obviously, the illegals coming over here is a major concern.
Yes.
Oh, when I talk to some of my staff who have relatives that have been in the system, legally,
Yes.
waiting,
Frustrating.
they get nothing
Yes.
except bills with attorneys, stalls ongoing to judges, to your point, make the process faster for those that are here so that they can be more viable to the economy.
Absolutely. And frankly, my sister-in-law immigrated from Korea, and I'll tell you that some of the most frustrating people in the country are the people who did it right as it relates to illegal immigration. They are very frustrated. It took her almost 10 years to become an American citizen. It's a long, arduous, painful process, as it should be, a very thorough vetting and understanding of what it means to be an American. When you have folks coming through your back door with no vetting, no actual process, acclimating or assimilating to what it means to be an American, it's nearly impossible, if not impossible. And
It's heartbreaking.
keeping us the city on the hill requires people to understand the advanced citizenship of being an American. We might want to start in Washington with people who are in the White House and that concept of what it means to be an American as well. We have to understand the damage, the devastation being done to our nation. And frankly, having a wide open, vulnerable border only sends a false signal to the rest of the world, and many of whom will die on the path here. There's nothing compassionate about that. That's tragic. And to see, young ladies sold into human trafficking as a result of trying to get to the border, preventable if we had secured our border and sent a message out that border is closed. It is actually the most compassionate thing we can do is tell people, don't come to our border illegally.
Well, I want to thank you, and again, 2019 is when our eyes were opened to actually what the cartels are doing.
Yes, ma'am.
Under the guise
Right.
of immigration. It's not. It's drug movement,
Yeah.
human life loss,
Yes.
systems being overloaded in a community that we're small. And we've got great law enforcement, but
Thank God.
we need people in Congress, in the administration, to fix it. Stop
Yes.
talking about it and fix it.
I told the sheriff he has a 15-point plan. That 33 or 38 sheriffs do.
31 border sheriff.
31 border sheriffs have agreed to. And I said, I want to absorb the information and use his expertise to improve my ability to serve the American people, and specifically counties that are contiguous to our southern border, so that we can have a president who doesn't just understand the issue, but I listen to the experts. That's the way you solve problems. Thank you, man.
Let's go to Tori at Amberley's Place, Senator.
Well, thank you for taking the time to visit our community. We
Yes,
certainly
ma'am.
do value and appreciate you. I have the honor and privilege of serving as the executive director of our Family Advocacy Center here. We serve about 3,000 plus victims of domestic violence, sexual assaults, elder abuse, child abuse, human sex trafficking, sexual assaults annually. And so it's super important, not only for our community and for our agency, for you to leave here today with the understanding that in a big map, small hands world, it's easy to view this from way above. And just as you mentioned with our sheriff having expertise, victims of crime also require a tremendous amount of support. Things like our VOCA fund that funds the majority of victim service programs throughout the United States of America and allows us to do what we do are really, really crucial to the work. How does that impact us with regard to human trafficking and fentanyl? Well, it impacts us greatly. With a wide open border, the cost is significantly high in terms of women and children in particular coming across and making a perilous journey that often leads to victimization. And that victimization isn't pretty. It's not dinner table conversations, or it's, these are lives that we're talking about. And so whatever you're able to do in order to help folks to really have a clearer picture of the travesty, the loss, the human fallout of having a wide open border is crucial, because the current narrative doesn't allow anybody to really see what we see on a daily basis. So thank you for your time. Thank you for your authenticity and your genuine interest in our community, and welcome to Yuma.
Thank you for your work, honestly. When I was in your position a few years ago, probably 15 years ago or so, on the county level, my city started our first women's and children's shelter. And the county was a part of the funding mechanism for it, along with the food bank. We provided resources to the food bank. And I can't imagine seeing your food bank go from 250,000 to 340,000 people in the span of a short period of time. And that means that the crushing crisis that falls on your doorsteps, the human crisis, is devastating. And I know that the hospital, when you see those kinds of numbers exploding, there's no doubt that the healthcare system itself is likely overwhelmed with the consequences of this challenge. I could be wrong.
No, you're correct. Dr. Magoo is going to talk to that right now.
Sure. Thank you, Senator, for being here. So, as you know, it's we take care of everybody who walks in these doors.
Yes.
Almost 80,000 patients seek care here, and it's not an easy place to recruit. And we do employ a lot of physicians legally. I mean, they're all, they're foreign trained. We have a medical education program, but all of that comes at a price. When you have 85% of patients between Medicare, Medicaid, and or no insurance, then even one migrant really impacts our ability. But taking care of migrants is our duty, our job. We have been doing that as long as the hospital exists. We had a major issue just a year and a half, 2 years back, when we had a big, I would say, numbers
surge.
And still, that's almost accounted for $26 million in charges, and we still have knocked every door possible. Fortunately, we can now, going forward, able to build Arizona Medicaid for some of those. But what has happened? There has been no movement on that.
Are you working with your members of Congress and the Senate to coordinate that? Okay.
We have done that. We have done that through the Arizona Hospital Association.
Yes.
Also through the governor's office. I think this problem definitely needs a solution.
Absolutely.
But more than that, I think at the border hospital and among other border hospitals, we have the most impact, and we'll continue to have the most impact going forward.
Yes.
Again, we are here for the community. We'll try to get the best care possible, best providers possible. We even though we struggle, we have been very successful in adding more than 150 providers in the last 6 years. We have 16 additional services. We've reduced the out-migration to almost 50%, so that patients don't have to travel 200, 300 miles out for basic services. But again, all of that, will need support, and I think your vision is absolutely spot on, and anything you can do to make it successful, we are part of that. Thank you.
As relates to the footprint seems pretty wide for the hospital utilization, 300 miles. I mean, it's a significant footprint. Now, are you utilizing? I know that during the pandemic, myself and a couple of other senators, we crafted legislation around telemedicine.
Yes.
To try to use technology as a way of bridging the gap in some of the harder to reach communities that have very few doctors present. Is that part of the strategy that you use here as well?
We heavily dependent on telemedicine. Still have some challenges, though. We are still struggling with some parity laws.
Yep.
Obviously, the broadband expansion in this community will really help.
Yes.
I think telemedicine.
We took our ARPA money and we invested $30 million in building a robust backbone for the entire county, because we found out that during COVID, the communities that were most affected were the outlying and rural and poorer communities. So at the end of that, everybody will be able to tap into that system throughout the entire county.
Do you have a strong opinion on the, so for us, we designed the system around, basically virtual care being visible. You got to see the patient. I know that many of our seniors don't necessarily embrace and adopt it very quickly. Do you allow and or think positively about the using the telephone as opposed to the iPad or the phone?
Seniors have actually had a little longer learning curve, but they have adopted very well.
Okay.
I think I think the limitation is the technology
Yes.
and the backbone. If that is resolved, we not only have to do it, that's the only way will be able to provide coverage in this area. So we are committed to doing that. Again, the technology comes at a cost on our end, but hopefully with the rollout, it will help us to build that bridge.
Thank you very
Yeah,
much.
Senator, I think I would add to that. You spoke and you talked about your mom just retiring.
Yes.
A lot of people are leaving the workforce, and so that's a top priority for us, both for physicians and nurses. We need our nurses. We can't care for patients without nurses. Deb's looking into, I think, a really innovative idea of allowing those nurses who are retiring or wanting to slow down. It's hard on their feet. They work on their feet all day. To be able to do virtual nursing from home, so they were on their feet all day and could actually guide our younger nurses. I think that's really innovative. It will come at a cost to be able to do that, but once we set it up, I think it will give us a long-term way to have the experience of the long-time nurses, and they love their passion.
It's like a mentor. Almost like a nursing mentor.
Help a young nurse, yes. And to be able to do that remotely without being on their feet. So again, I think Jonathan mentioned, as a community, we're 3 hours away from everything, right?
Yes.
So we become very collaborative, and I think innovative in our solutions. We always look to help ourselves before we seek support from others. And so I think that's another way we want to use technology to be able to support the care of our patients here. Who cannot, by the way, it's not just an inconvenience to travel to Phoenix for care. It's a real hardship. And in many cases, just not even feasible for families.
I know that you're getting
This is your closing remarks.
Okay. Well, before I close, I do want to ask the question. I love pilot programs because it gives us an opportunity to experiment in a positive way to see if it works or if it doesn't work. And I'd love to hear the results of the program, because sometimes we need a national model that can be scaled into other communities. I hadn't thought of that, which is not surprising to anyone who knows me really well. But the truth is that I thought it was funny too. Thank you very much. And true, unfortunately. Most of my ideas come from someone else's cranial cavity, and I like that. So I would love to, if Jonathan, maybe you could be the conduit. I'd love to see the result of that, and to understand how we would scale it. If it works here, can we have more pilot programs and see if the effectiveness allows for us to pull some of the pressure off the shoulders of the folks who are doing the jobs. Just a little direction goes a long way. My mom was a nurse's aide, and not a nurse, so she was at the bottom of that food chain, and understanding the misery that comes with that experience sometimes is important, but also the thrill of being able to help people transition from one location to the other location is really powerful when you hear about it.
It's what you would want for your own family, right?
Yes, exactly. Thank you very much. That's been really helpful.
Keep behavioral health at the top of your list, please. That's another one. I think the nation is struggling with that.
I think you're right. And another,
you're good.
I'll just say this, that one of the unfortunate realities that we're facing as a nation that we haven't dealt with is that we're in the midst of a mental health crisis in a way that we don't fully embrace. During the pandemic, we saw a 30 or 31% increase in parents bringing their young kids to the ER because of a mental health breakdown, and that is a symptom to a much greater problem that we as a nation need to become really honest about it. 100,000 drug-related overdoses is another one of those symptoms, and if and the suicide rates are they're skyrocketing. So we have some real issues that we need to wrestle with as a community, and I would benefit from the healthcare experts from around the country who have ideas and thoughts about it. That would be really important for us to be able to capitalize and maximize our response as a community, and I'm talking about America as a community, to what we know too many people are going through, and it's a silent killer, unfortunately.
Thank you very much, Senator.
Absolutely.
Appreciate your time.
Yes.
And as a presidential candidate, thank you for being here to listen to our community. We collaborate. We look to resolve a lot of our challenges internally before we look to anybody else. I think that's one of the greatest things that I'm proud of in our community. You can see everybody coming together in every sense. One of the things that we didn't mention, I'll make sure you get a full briefing on that, is how it impacts our military when we have people coming across the bombing range during live fire exercises. The Marines Top Gun exercises are held here every 6 months. That's called Weapons and Tactical Instruction, and they actually have to shut down live fire. So I'll make sure you get a full briefing on
Okay,
that.
thank you very much. You've been a wonderful host.
Thank you very much.
Sheriff, thank you for your time this morning. Truly.
And thank you,
Corey, I
everybody.
think it was Corey, thank you for your time as well. Appreciate y'all. Thank you for your time.
Thank you.
Thank you. I'm so sorry for your loss. See? I will.
We'll take a couple questions. Senator, some of your Republican colleagues who are also running for president have promised to end birthright citizenship for the children of people who are here illegally. Would you do the same, and do you think that you would have the authority to do so without change?